Welcome, welcome, everyone. It is Aaron Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome to Hot Seat Saturday. I hope you guys are enjoying your weekend or the start of your weekend. I am. It's a beautiful day here in Atlanta. It looks like it's going to be a gorgeous weekend, so I can't wait to get out there. But before I do, I want to spend a little time with you as I try to do every Saturday right here at 11 a.m. For those who you are not familiar with me, I am a board certified plastic surgeon, as I mentioned a million times before, here in Atlanta, almost 2 decades of experience. And I started this platform to connect to more uh, people and try to spread the truth in plastic surgery. And on that note, I had something I wanted to talk about this week. I thought it was really interesting. I was going to talk a little bit about red light therapy, some cupping type of procedures. Uh, I'm a little unfamiliar with that. And so I thought I would dig in and kind of give you the skinny on that. But, this topic never seems to stop. And I just had to put the red light therapy to the side and talk about once again, and I've been talking about this probably since I started almost 20 years ago. Safety in plastic surgery. Just let me set the stage. I have a medical license, my colleagues have a medical license, and they're of different specialties. I have colleagues in surgery, anesthesia, dermatology, internal medicine. I'm in plastic surgery. We all have unrestricted medical license. So if I wanted to get a wild hair tomorrow or say Monday, switch this clinic around or my practice around from plastic surgery to neurosurgery and start working on people's backs and brain tumors, legitimately, I could do that. I wouldn't do that, but I could do that. So it's the same scenario. We're going to flip it around. Tomorrow or Monday, someone of a different specialty other than plastic surgery, I'll just say that, can flip it around and decide that they are a cosmetic surgeon, a plastic surgeon. They have an aesthetics spa. They can do that. They have no restrictions on that. And so I bring this up again because I'm sure you guys are tired of me talking about it, but let's just bring up the let's just bring this up. All right. The CDC, y'all. The CDC is investigating kind of a bad batch of Botox. Now, just for understanding, I have to have a medical license to get Botox. Anyone who has a medical license, I believe, can get Botox. I get my Botox from AbbVie, which has a subsidiary called Allergan. And they have been a player in the market forever and a day. I get my Botox from there. It is legitimate. It is has tremendous quality control, and I've never had a problem. Botox, the patent has was owned, I believe, and I can be corrected by AbbVie or Allergan. And that patent has lapsed many years ago. And so you can get Botox from other places. And the Botox that you can get from other places may not be up to par. And in this case, this batch of Botox was not. When I first looked at this, and I'm going to pull this up on my screen, you can't see it because I want to do it justice. I don't want to misquote it. And I'm just going to kind of read the intro paragraph. At least 19 women in 9 states reportedly became sick after they got Botox. Either have gotten the injections from people who were never licensed. Let me say that again, never licensed or trained to give the injections or receive them from a non healthcare setting, including homes, and the article says spas. This is from the CDC this past Monday. So, again, it drives home doing your homework. Of course, I would love you to see me. But if you can't get to me, it's not possible. You need to do your homework. If you're going to have Botox, which is a fabulous procedure to have, it's minimally invasive. It provides significant improvement of wrinkles of your forehead, your crow's feet, your brow. It works and it is safe when administered appropriately and by the right people, train professionals. So, really be careful. Really, really be careful. You can really get into some serious problems. This particular case, I mean, this spread from Colorado, Florida, Illinois, Kentucky, Nebraska, New Jersey, New York, Tennessee, and Washington, as I look at the article. And I'm assuming that's Washington State. And so it's widespread. And the problematic reactions, as per this article, were blurry or double vision, which is a hassle and can be, capacitating because if you have that and you're need to drive to work, get your kids, whatever, you may not be able to do that. It causes droopy eyelids. These patients had difficulty swallowing or breathing, which I don't even have to tell you is a problem. They had dry mouth, slurred speech, fatigue, and weakness. So I say this again because I have to keep saying it after nearly 2 decades. Please, 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 please don't villainize so much the procedure. People kind of get all in a knot about, oh, I don't want to have Botox, it's dangerous. Yes, any medication is dangerous. Your blood pressure medication is dangerous when administered improperly and by someone who doesn't know how to properly administer it to you and properly recognize any issues. So, again, don't throw the baby out with the bathwater. Really do your due diligence. You can get your Botox from a plastic surgeon. You can get your Botox from a dermatologist. You can get your Botox from a nurse injector as long as those folks have been trained. And if it's a nurse injector, at least here in Georgia, they don't have complete autonomy where they can, as an injector, practice solo. They need to be have oversight or guidance, or at least have someone that is responsible above them, either a plastic surgeon, in my opinion, or a dermatologist. Period. In the story. So be careful. So that's one thing I wanted to talk about this morning. On the same note, I know I just keep whining and whining on the same note. This kind of got me in a tizzy last Sunday. I think I was sitting with my wife and I was reading an article, and I can get into many versions of this. I even commented in this article because of the different debates within the article and the comments about who's better trained. And I'm not even going to get into that. I'm going to touch on it, but it's such a deep dive. It would take us centuries, and we still haven't really solved that. So the headline is Deadly Liposuction by a Pediatrician Highlights the Dangers of Unqualified Cosmetic Surgeons in California Surgery Wild West. So, to just break this down again, I don't want to misrepresent this, so I will read the opening paragraph, maybe two. I'm not here to read to you like a child. I will try to provide these links in the comments below so that you can read for yourself because I think it's important that you have this information. All right, so inside a clinic wedged next to a smoke shop in South Los Angeles strip mall, doctor, and I won't say it, you can read it, uh, operated on a 28-year-old woman who had traveled from Las Vegas to have fat trimmed from her arms and stomach. Doctor had been offering liposuction for roughly 7 years. When he started making incisions that day in 2020, he did, but he was trained as a pediatrician when he started 7 years ago. I did quite a misquote it, but my gist of it, he started 7 years ago. He decided to up his ante by kind of doing incisional surgery, but is trained as a pediatrician. Pediatricians are not trained to do or perform surgery, invasive surgery. You have pediatric surgeons for pediatric surgical issues. This is a 28-year-old woman who doesn't like the contour of her arms. And there are different ways to go about it. But neither a pediatrician, and I'm not picking on pediatrician in a general sense, or neither pediatric surgeons, I'm not picking on them in a general sense, have that training. That's not how they look. They don't look at patients and think about the possibilities of what can be. That's not what they do. They look at your child's RSV, your child's, uh, asthma, your child's childhood diabetes, other things. They look at your child's hernia. Uh, Unfortunately, if your child doesn't have necrotizing enterocolitis, which is a bad problem to have, that's what your pediatric surgeon does. I don't think about those things anymore. I don't do that. They do that. They're the expert. I do this. I look at the contour of someone's arms, determine what the best method of treatment is, if there's any method of treatment, and determine what's right and what's wrong and what's safe. What's safe. Here's another thing that blows my mind. Just in the beginning of this article, it's she lives in Las Vegas and she traveled to Los Angeles. There are a ton of qualified, board certified plastic surgeons in Las Vegas. Okay, she didn't like them. She traveled to Los Angeles where there multiply that by 5. There are tons of board certified plastic surgeons. But between those two major cities that have a really good, strong population of board certified plastic surgeons, she decided on none of them. None of them. And I like to really hear from you, the people, why you think that would be. I mean, what are the driving forces? Why would you go from one major city with great plastic surgeons to another major city with great plastic surgeons and have a pediatrician perform your operation? This lady died. This lady died. I think she had some unmanaged diabetes. She had respiratory arrest where she stopped breathing. He was, providing anesthesia. He probably did not have an anesthesiologist. And this is all in his office. So again, I know that, and I'm just going to put it out there, from my perspective, and you guys correct me, price is an issue. Availability sometimes an issue. A lot of us are booked out, and because we're have great outcomes and great clients and great reputations, and our expertise and skill command higher price points. And everybody's price sensitive. Everybody is. So I understand that. But you can't be price sensitive to a fault, to your death. This is your life. I think people, in my opinion, only make more conscious decisions about the type of car they're going to buy, the type of clothes they're going to buy, the vacations they're going to go on. I mean, people don't seem to really put decisions to the ultimate test when it can affect their life or in their life. So you want to make sure that you've got the right practitioner. You want to make sure for these procedures, body contouring, facial procedures, you want to make sure you have a board certified plastic surgeon. And I'm going to give you a couple links at the kind of toward the end of this so that you'll know how to get that information. But here's some things if you don't know and you just walk into the office, you have a consult, look at the office, look for certifications by the American Board of Plastic Surgery, ask for them. And if you can't find that or no one has it at the moment, they'll get it to you. Then, okay, so well, and so be it. Move forward if you feel comfortable. Have the consultation with the doctor, speak with the doctor, ask him or her, you know, how many of these have they done? Do they have some before and after pictures? Can they walk you through the process? Can they walk you through the best case scenario? Can they walk you through the worst case scenario? And you, as the client, you need to really look at how they are explaining that to you. Is it nervously, sheepishly, or is it with confidence and authority? I mean, you got to pick up on the nonverbal cues as well as the verbal cues. But here's one thing I do want to leave you with. Let's say you get past all that and you're still cool with it. You want this doctor, the cosmetic surgeon, to do an arm lift on you. But he says, or she says, we don't want to do it here. We don't want to do it in the operating room at the hospital. It's crowded. You get a lot of infections. It's just really tough to negotiate. It's expensive. We can do it here in the office. I've done these for 7 years, and we could just do it in the office. We'll give you something to make you drowsy like twilight or put you to sleep or make you just a little relaxed, and we'll just do it here. And you go, okay, that sounds good. The next question you ask, please hear me. Please hear me. Stop what you're doing. Hear me. The next question you ask, you go, doctor, okay, we're going to do an arm lift. What if I do want to go to the hospital? Can I have that same amount of information and maybe even the pricing for that? Do you have the privilege or privileges to operate in the hospital, to do this procedure in the hospital? If they do not have the privilege to operate in the hospital for the procedure that they're presenting to you to be performed in the office, then run. It's time to get. Grab your purse. Let's go. Grab the kids. Let's get out of here. It's time to go. As a board certified plastic surgeon, I do face, I do body, I do a lot of things. And all the things that I do, facelift, eyelid lift, chin surgery, cheek implants, breast lift, liposuction, tummy tuck, mommy mako, BBL, all those things don't fit in the office. But if I were to do that in an office or I had a legitimate accredited surgery center attached to my practice, I can do those same procedures in my local hospitals. And for those of you who are unfamiliar with Atlanta, you won't know these hospitals, but I can go to Northside Hospital and I can do it there. I can do it at Meridian Mark, which is an outpatient variation of Northside Hospital. I can do it at Northside Hospital Duluth. I can do it in the bedroom community of Snellville at Piedmont East Side. I can do it at Surgery Center, Chastain Surgery Center out on Roswell Road. So I can do all those procedures in outpatient settings or same day surgery settings. I can do the procedures that make sense in my office, upper eyelid, a little neck liposuction, a little waist liposuction in my office. And I can do all of those at the hospital, Northside Hospital and Piedmont Hospital. So if your doc can't do those procedures at the hospital, then she's not been vetted, nor do they probably have the training or credentials or the documentation of such so that the hospital will feel comfortable in allowing them to perform those procedures. So, buyer beware. Board certification in American Board of Plastic Surgery. Can you perform the same procedures at a hospital? Can you admit to that hospital if there's a problem? There was one more I had, but those are some really key things, really, really key things. So really make yourself aware and protect yourself. so that you can be well and be here for your family. It doesn't mean you can't get plastic surgery. You shouldn't get plastic surgery. You just got to get in the right hands in the right situation for the safest outcome possible. I just can't drive that home anymore. I've said it for the last 20 years. I'll probably be saying it for the next 20 years. Unfortunately, I would like never to talk about this, but I have to. And so I've told you about cases all around the country, from Kentucky to California. I'm going to show you a case from right here in good old Atlanta, GA. So let's look at this case. And I've had this case before. I don't know if I put it here. I put it on the internet in various places because it just it's a sad case with a great outcome and a great end game. But it just drives home all the things that we just talked about right here in Hot Atlanta. So let me bring up this case. So we have this young lady right here. She came to me probably, I'm going to say, mm, 12 years ago. 12 years ago, after she was referred to me by one of my one of my good friends, trained with him. I'm gonna give him a shout out, Dr. Weevu, who's a phenomenal trauma surgeon. Retrained. He's the coolest trauma surgeon I know, and I know a lot of them, and I love him, but he's cool. So Dr. Vu saved this lady's life because this young lady, who was unaware that her surgeon needed to be a board certified plastic surgeon. Her surgeon needed to be able to operate at the hospital for the same procedures that he was saying that he could perform in his office. Her surgeon didn't have the experience to deal with the routines of the surgery nor the complications. So let me tell you the story. So she goes to a surgeon who was popular at the time, who was doing, he was riding the BBL liposuction craze. It was at the beginning of that, it was ramping up, and he decided it and convinced this young lady, that she was a great candidate for liposuction, was transferred to her buttocks and her hips. And I don't know the ins and outs of the logistics, the pricing, but this was performed in his office. And after the procedure was done, she became relatively ill and been very ill, to the point where she, obviously contacted the doctor multiple times and really never got him, but got his staff. His staff was actually giving her medical recommendations, I think, from him, but that's debatable. It might have been just their best guess. Lo and behold, she ended up so sick. She ended up in a downtown Atlanta hospital in the ICU, near death, multi system organ failure. This area that you see represented was wide open. It was just, the skin had died, it was grossly infected. And my man, Dr. Vu, cleaned all that out, got her organ systems functioning back properly, got her well enough after many weeks to go from the ICU to the floor to outside of the hospital, alive and well. Now, again, she had the scars, so to speak, to bear from that. She had this hideous abdominal scar, and then she had some really bad scars on her hips, because during her hospitalization, all the dead fat, bad fat, dead skin had to be removed to save her life. The skin that had died was actually killing her. So it left her with some terrible scars, and she was young. She was in her early 20s. Imagine if this were you in your early 20s. I mean, just the trauma from the experience, and then the trauma to have this as a reminder of the experience as a 20-year-old. Heck, it's bad. It would be bad at any age, but especially at this age. So Dr. Vu referred her to me. I met with her. We talked about it for a bit, a month or two. She was skeptical, I'm sure, because she just went through a, Armageddon, and she was happy just to be alive, but she still was wanted to feel confident as a woman. And so she finally said, what's your plan? And this is not in the textbooks. This is not standard training. This is where the rubber meets the road. This is why, as a plastic, and I'm going to say reconstructive surgeon, this is where it all comes together. What do you do with that? This is not a tummy tuck. Could your cosmetic surgeon fix this? No. What strategies? So I use strategies from my training as a plastic and reconstructive surgeon. I use aesthetics and reconstruction. And so what I did, I told her, I was like, look, this is going to be a stepwise process. We're going to have to do at least two surgeries. Here's the first surgery. I'm going to have to make an incision kind of along the middle portion of that dark incision. And I'm going to have to get underneath the skin above that scar in your upper belly, between the skin and your muscle, and place balloons so that I can slowly over time stretch those balloons out so that it looks like you're pregnant. So we have excess skin, because that's the only way I can get rid of that scar. I need to be able to take that scar out and repurpose or pull the skin down. So, using reconstructive techniques of tissue expansion that we use in breast, in scalps, and all those things, I was able to implore that or apply that to this situation. So we placed the tissue expanders. I put three expanders in, one in the center, one on each side. And for about 2 to 3 months, we slowly expanded that skin in the office to she looked like she was about 7 to 8 months pregnant, and that she couldn't take it anymore because it was getting too tight. So at that point, we were ready for surgery two. And you're like, well, what's surgery two? I've got this hideous scar that's way too high, and I don't want to leave the permanent scar that high. I wanted to really make this a tummy tuck, but I don't know if she even has a belly button. So I needed to make sure that I could get the scar lower. I need to make sure that she has a belly button, and if she doesn't have a belly button, how was I going to reproduce one, and when was I going to do it, at the same time or at another surgery? So our main goal was to get the scar lower, down by this panty line that you see, to remove this hideous scar, and to go from that point. So I was able to remove the tissue expanders at surgery two. I was able to take out that scar completely, and it was stuck down right to the fascia. There was no fat in between the skin. It was stuck right down. So I had to gingerly kind of peel it off the next layer without getting into the abdomen, which is another whole issue. So I did that successfully, methodically, and I was able to then lift the skin up above what you would think the belly button where it would be, and I found the belly button, and I kind of carved that out, for lack of a better term, preserve that. I was able to pull that extra skin down and lower that incision so that it looked more like a tummy tuck incision, and put the belly button where it should be. That worked out famously. And so here is her post op, I'm going to say about 2 to 3 months later. Better. She can at least wear nice undergarments, feel better about herself. We've come a country mile, as my mama would say. And we were all pretty happy about that. We were both pretty happy about that, for sure. Here's the power of time. I did nothing to that again, ever. I tried to work on her hips. Those were problematic because of scar. I tried to fat graft, and we did a lot of things to hips, but I did nothing to this. Here's where, and I'm gonna throw in a little different subject matter. Here's where you got to trust the process. You got to be patient with it. It's going to change. This is 2 months. It's going to look different, better in 4 months, better in 6 months, better in eight. You get the drift. So we're going to fast forward 2 years. 2 years. This is what it looks like or looked like 2 years later. So imprint this in your mind. It's not bad. It's certainly better than this. So we've come a long way. Now we have this. Belly button looks a lot softer than it did. She tattooed around there, which is cool, but her scar is right where her undergarments are. I took, I'm not trying to pat myself on the back, and I won't break my arm doing it, but this is why, as plastic surgeons, we are the go to people for aesthetic procedures. Most certainly, no one's going to argue about reconstructive procedures because, to be honest with you, there's no money behind that. This is all about money and people getting into aesthetics, which is lucrative. I have, my colleagues have the training to take care of this. So if this is your tummy tuck and it goes sideways, we can fix it. I can't guarantee your cosmetic surgeon is going to be able to do that. I'm not saying they can't, but it's probably less likely. It's probably less likely. So I got a comment. I appreciate that, Ms. Robin. I really appreciate you tuning in. Appreciate everyone tuning in, even if you're not commenting. But thank you so much. I appreciate it. But this is why. This is why we need to have these conversations. This is why I make these videos so that you can see the difference. It's a difference in training, thought process, and safety for you. And let's be honest, it's a little ego thing for us. We want to make sure that we put out and perform well and have good results. So people will talk about their experience and their results. But we want to do it safely. You know, we want to do it safely. And luckily for this young lady, she survived. Thank heavens. She was in the right hands with a general surgeon who performed and trauma surgeon who did what he was trained to do. He didn't ask me to do that. That's not what I ultimately trained to do and ultimately do every day. Once he got her to where he could not do anymore outside of his training, then he put her in my hands where my training came to play into play. So you got to know your lane. You got to know your lane. And so be wary of all these practitioners who are not in their lane. And the only reason they're trying to get in the lane because they think the lane is filled with a bag of money. So please, 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 please be careful. Couple things I want to share with you. Couple of things about how do you find out if you got the right doc. Do you have a board certified plastic surgeon? So, how can you tell that? You can simply go to the American Board of Plastic Surgery. Here's the link, the website. You can simply go, there's a search bar at the top, type in the doc's name. There might be even a little kind of menu that says, is your doctor certified? Type in the name. And if they're certified, then it'll show up. If they are, then good for you. You've checked off a major box, and you can ask the other questions. Do you have hospital privileges to perform the procedures that you're recommending? What are your before and afters? Do you feel as the client, as they speak to you with experience and authority? Then you're probably in good shape. Again, I want to be clear. Just because you are a board certified plastic surgeon doesn't mean you won't have any complications. That's not the argument I'm making. The argument I'm making is that if there are complications, one, we know how to take it, And we can recognize who's safe to perform surgery on, where it's the best place to perform surgery on. So, perform surgery at, whether that's a hospital, accredited surgery center, or office. So, we have these quality assurances built into our training and the way we approach our clients. So that's one place that you can find a board certified plastic surgeon. You can also find them in different societies. Most of the board certified plastic surgeons are a member of the American Society of Plastic Surgeons. In order to join this society, you have to be board certified or board eligible, meaning that you are in the process of becoming certified. If you have not passed your certifications or couldn't pass your certifications, then you cannot join this board, nor can you become, a diplomat of the American Board of Plastic Surgery. So you can't be a part of this group, and you certainly can't be recognized as holding a board certificate in plastic surgery from the American Board. Lastly, you can also check with the Aesthetic Society. This is a society of board certified plastic surgeons only. And in this one, you can only be board certified as a complete member. Uh, and you're a plastic surgeon, if he or she is a member, then they're board certified. So if I were you, I wouldn't just check one, I would check, all three, or at least two of the three, and make sure that your surgeon has had the adequate training. They've had, you know, they've been kind of grilled. We were kind of grilled to make sure that we were practicing safely after we were out. Board certification examinations don't happen the day we graduate. They let us, or we practice because we can, for 3, 5, whatever years, and accumulate cases and present these to, you know, members of the board and defend these cases. And then they give us unknown cases and see how we would handle it so that they can make sure that we are safe. So I've been on my soapbox for almost 40 minutes. I would love to have questions. If you have a question, this is the time to ask. I mean, you get me for at least 30 minutes, maybe 45 minutes, or whatever it takes to talk about the subject of the day for free. So, I mean, I would capitalize on it. This video will be kind of running in perpetuity, so you can always watch it later, but I can't answer your questions then. I can try if you leave a comment, but you got me now. It's almost like how you like me now, but you got me now. So just ask questions. This is for you. This is a great time to ask, and get those questions answered. And if you want to take a little deeper dive with me, I invite you to a couple of places. I'm a little bit everywhere, but I'm always, and I'll start at the office. I am always in my office. My office is open 5 days a week, 9 a.m. to 5 p.m. And you can call the office. My office is ESJ Aesthetics, and we're in Dunwoody, Georgia. Beautiful area. Love it. For those of you not familiar, this is in North Atlanta. So we're there, and this is our number. We're at 770-466-4700. If you would like to schedule a consultation with me to talk about a procedure that you want, you've been thinking about, it's been years and years, the kids are grown, your husband seems to be good, you've kind of sacrificed, it's your time. Now's the time. So if you're ready, let's just go ahead and make that consultation. If you aren't quite ready, you want to check me out a little bit more, I've got a couple of places you can check me out. You can follow me on my Facebook page at Beauty by Design, and that's in Facebook. And here is that link. So please jump on, follow me. I post a lot of things. I do a lot of video. I think video is powerful, so you'll get good content. If you want to take a deeper dive and you want some exclusive access, maybe not as much as coming to the office, maybe certainly more than just on my Facebook page, I invite you to join my Facebook group. I have one for women and I have one for men. So our women's Facebook group is called, and I changed the name because oh my gosh, that name was brutal. I mean, I don't know why I picked that in the beginning, but nonetheless, New Facebook women's private group is called Contours and Conversation. So I invite you to join. The reason you join is that you can get more access to me. I have some really exclusive things that I offered and will be offering to the members of that community. We've got a weight loss program where I'm vetting, you know, practitioners. I've just spoken with a weight loss management physician. He's agreed to come on board and provide some content for those who want to be in the best health, best position to have aesthetic surgery or just to be in the best health. I'm going to talk to one of a fitness trainer who I've known for a long time. She doesn't know I'm going to contact her, but I'm going to contact her. We're going to get with a nutritionist. So we'll have all these resources, but those are only if you join the community or if you make a consult. So I encourage you to join that community, and that link is there. So if you want to join, please do. I encourage you. For my fellas, I have a group as well. I'm just really starting to kind of get into that, and I'm posting as of this month, so it's not as robust as my women's group. And I've even started posting more in my women's group, and I'm gonna have a lot of focus there. But back to the guys, you want to join? Got a group for you. So my men's Facebook group is called Modern Gents. Again, same kind of premise for as for the ladies. We're going to post stuff that's really dedicated to you. We're going to talk about chest contouring, gynecomastia. We're going to talk about facelift. We're going to talk about eyelid lift. We're going to talk about fillers and Botox. We're going to talk about liposuction of your abdomen and flanks, getting you sleek and masculine. So, if you want to join that page, you certainly can do that. And here is the link for that. So please feel free. So I'm in a couple of places. I'm here. I'm waiting for you. So you have a couple of ways that you can connect with me. So really no excuse if you're really interested. So I encourage you to join, and I encourage you to invite friends to join. So I have taken enough up of your Saturday morning. I hope you've enjoyed it. If you didn't catch it, or you're just catching the end of it, catch the replay and share. So I will see you next week. Enjoy your weekend. Until then, peace.